Hello. So today is Wednesday, April 19. It's time for my COVID-19 update. I'm going to share you also a lady video that she has a friend inside the hospital in New York City, and she's telling about what's going on inside the hospital, how they treat the COVID-19 patients. Take a look at this.
I'm sure I'm going to get some hate messages after this. Frankly, I don't care because this could save someone's life. I'm a nurse practitioner. I am licensed and certified. I am not on the front line.
She's a nurse practitioner. She have a friend, a frontliner inside the hospital.
Safety, she cannot come out and say these things, so I am her voice. I'm not going to name names of people or hospitals for the safety of those involved.
People inside the hospital are not allowed to say anything outside.
Wants this to get out. No, I'm sure this is not the case everywhere. I'm confident. I have friends that are in other places. They're on the front lines. They're in ICU.
Not referring all hospitals. There's only a specific hospital in New York City.
What's going on? People are sick, but they don't have to stay sick. They are killing them. They are not helping them. She used the
Hear an accusation like this is not good.
Not helping them. She used the word murder.
Sad to hear an accusation. It's an hospital. They tend to take care of the sick people, not to kill.
Patients are left to rot and die. Her words. She has never seen so much neglect. No one cares.
Patient to die. It's like I cannot imagine.
A couple of weeks ago, I was on with some nurse friends of mine, and we were discussing different medications that could be used to potentially help people. Doctors who were reporting around the country that they were using a combination of medication.
Right. Why not try the other doctors doing just to help the patient alleviate the suffering? Who knows? It will be effective to them. Since we don't have yet proper medication for that virus, why not try?
They were getting better. Those medications are not being used in hospitals in New York City. What is happening is that they're putting people on nasal cannula if they require more than 6 liters of nasal cannula. Those medications are not being used in hospitals in New York City. What is happening is that they're putting people on nasal cannula if they require more than 6 liters of nasal cannula. They get intubated, they go on the vent, or they get trached if there's not enough vents. They don't get high flow, no non-rebreather, no non-invasive ventilation, no CPAP, no BiPAP. They're on a closed system, the ventilator, versus a CPAP or a BiPAP for fear that it will spread the virus. Which, by the way, I know a nurse in Florida who was fired for exposing.
It's really, really bad to hear this issue, especially in New York, USA.
Like straight away to the ventilator to be on a closed system. The patients don't know any better. They don't have family with them. There is no one there with them to advocate.
I feel sorry for the patients if this is really happening.
And they give consent. The ventilators have high PEEP, high pressure, which then causes barotrauma. It causes trauma to the lung.
Yeah, this is not right. Just to put on right away in the ventilator, it causes more damage in our lungs.
Cameron Kyle Siddell, a few weeks ago, put out a video. He's in New York City, and he put out a video saying something.
I saw that video also before, that the doctor saying ventilation, I think it's not helping. They are doing it in a wrong way. It only causes more damage to the patient.
They pulled his video from YouTube and they took him out of ICU. Doctor going against the grain, going against their protocol.
So we have no proof if it's true or a lie. So it's up to you guys. But to hear that there's an accusation for the some hospitals like that, it's not a good one to hear it. Hospitals are tend to treat sick people, not to kill people. I'm going to do my Worldometer update. This is Worldometer update, April 29. Coronavirus cases is now 3,148,709. Deaths 218,383. Recovered 962,459. Active cases, we have 1,967,867. Serious or critical is 56,903. It's 3%. Mild condition 1,910,964. That is 97%. Total cases, number 1, USA 1,035,765, followed by Spain 232,128, Italy 201,505, France 165,911, UK 161,145, Germany 159,934, Turkey 114,653. Cases, number 1, Russia 5,841, Mexico 1,223, Singapore 690, Bangladesh 641, Belgium 525. That's USA 59,266, Italy 27,359, Spain 23,822, France 23,620, UK 21,678. That's Belgium 170, Mexico 135, Russia 105, Philippines 28, Brazil 20. That's all for my COVID-19 update in Worldometer. Update here in Qatar of COVID-19, since I wasn't able to mention it yesterday because it's not yet out in the public. So yesterday, they have 667 new cases with the total of 11,911 coronavirus cases here in Qatar. There is recovery 68 patients, so with the total now of 1,134 recovered patients. Qatar designated 5 hospitals for testing centers and isolation hospitals for COVID-19 cases. So the director of the Public Health Department of the Ministry of Public Health, Dr. Sheikh Mohammed bin Hamad Al Thani, said that Qatar has so far designated 5 hospitals to care for coronavirus patients, along with 4 health centers for testing, examining, and keeping suspected cases, in addition to a hospital for medical isolation. The 5 hospitals were designated to treat COVID-19 patients, which are the Communicable Disease Center and Hazam Mibarak General Hospital, the Cuban Hospital, Misaid Hospital, and Ras Lafan Hospital, in addition to 4 health centers for testing, examining, and keeping suspected cases. That's all for my Qatar update. Now let's go to the UK follow-up update. So, underreported care home deaths in increased UK's coronavirus tool. Britain on Tuesday said it would extend reporting of deaths in the coronavirus outbreak to care homes and the wider community after new statistics indicated the country had been underreporting its tool. Until now, only the deaths of people who have tested positive in the hospital have been reported. From tomorrow, Wednesday, we will publish not just the number of deaths in hospital each day, but the number of deaths in care homes and the community too. That is according to Health Secretary Matt Hancock. That's all for my update today. Be safe, stay at home, and God bless.